Acute stress disorder is a psychological condition that can develop after exposure to a traumatic event. It is characterized by a range of symptoms that can include re-experiencing the trauma, avoidance behaviors, negative mood, and hyperarousal. In this presentation, we will explore the causes and symptoms of acute stress disorder, the DSM-5 criteria used to diagnose it, and available treatments. A stress disorder is typically caused by exposure to a traumatic event. Traumatic events can include a physical or sexual assault, natural disasters, accidents, combat exposure, sudden loss of a loved one, and medical emergencies. Individuals who experience a traumatic event are at risk of developing acute stress disorder, and the severity of the event can also impact the likelihood of developing the disorder. Risk factors for developing acute stress disorder can include a personal or family history of mental health disorders, a lack of social support, and other stressors. Acute stress disorder and post-traumatic stress disorder, PTSD, are both psychological conditions that can develop after exposure to a traumatic event. One of the primary differences between acute stress disorder and PTSD is the timing of the symptoms. Acute stress disorder symptoms typically develop within 4 weeks of the traumatic event and last for a period of 3 days to 1 month. If the symptoms persist beyond 1 month, a diagnosis of PTSD may be considered. The DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5th edition, provides diagnostic criteria for acute stress disorder. To meet the criteria for acute stress disorder, an individual must have experienced a traumatic event and exhibit 9 or more of the following symptoms across 4 categories. 1. Intrusion symptoms, re-experiencing the traumatic event through flashbacks, nightmares, or intrusive thoughts. 2. Negative mood, persistent negative emotional states, such as fear, guilt, shame, or anger. 3. Dissociative symptoms, feeling detached from oneself or feelings of unreality. 4. Avoidance symptoms, avoiding reminders of the traumatic event or avoiding situations that may trigger memories of the event. 5. Arousal symptoms, hyperarousal, including increased startle response, irritability, and difficulty sleeping. There are several effective treatments for acute stress disorder, including cognitive behavioral therapy, CBT, exposure therapy, and medication. CBT is a type of therapy that helps individuals understand and manage their thoughts and emotions related to the traumatic event. Exposure therapy involves gradually exposing the individual to the traumatic event in a safe and controlled environment, allowing them to confront and process their feelings and emotions related to the event. Medications, such as antidepressants, can also be used to help manage symptoms of acute stress disorder. It is essential that individuals with acute stress disorder seek professional help from a mental health professional experienced in treating trauma-related conditions. Acute stress disorder is a psychological condition that can develop after exposure to a traumatic event. Symptoms can include re-experiencing the event, avoidance behaviors, negative mood, hyperarousal, and dissociative symptoms. The DSM-5 provides criteria for diagnosing acute stress disorder, and effective treatments include cognitive behavioral therapy, exposure therapy, and medication. Individuals who experience symptoms of acute stress disorder should seek professional help from a qualified mental health professional.